It is a privilege to be here today to represent the members of the UK CEDAW Working Group. The Working Group has provided you with our first list of critical issues facing women in the United Kingdom, and I would like to summarise our main points under the broad areas of policy changes and austerity measures and the impact of these on women, women's health and in particular violence against women and girls, and communication structures on gender equality within government. I do not feel that it's too dramatic to say that women's rights in the UK are being rolled back, and I want to outline how the policies of the current government are leading to a regression in women's rights, rather than the progression demanded by the CEDAW Convention. Across the UK we are seeing a disregard for women's equality and a threat to human rights in general. Women's hard fought for rights under every CEDAW article are being reduced. Personal, social and health education, which impacts on sexual health and confidence, is no longer compulsory, and schools are not safe for girls. While the representation of women in the media continues to be unequal and damaging, reinforcing gender-based stereotypes and sexism. The widespread closure of Sure Start centres and the high cost of childcare, which is the highest in Europe, leads many women not to seek work at all, while female unemployment is at a 25-year high and the gender pay gap is still far too wide. Government policies around welfare benefits and other support are disproportionately impacting on the most vulnerable, and measures such as the universal credit will see women trapped in violent relationships with nowhere to turn for support. The lack of government support for women's NGOs, despite demonstrating value for money, and the decentralisation of power to local authorities who are also facing huge cuts, means that local services for women are closing at a fast rate, leading to a lack of appropriate accessible provision for many women. Women's specific health needs are not addressed, and we still see more women than men reporting debilitating mental health problems, while there are GPs who illegally perform female genital mutilation. The localisation of healthcare and changes to the National Health Service also risks women falling through the gaps in provision, and is why a gendered approach to help is even more important. There is also a danger that women's reproductive rights will be rolled back with government support. Violence against women and girls still occurs in the UK at epidemic proportions, and austerity measures, which have led to high unemployment and increased debt, are creating an increase in violence and impacting on women's safety as support services are being cut. The women's NGO sector in the UK have contacted and advised the government on these issues on numerous occasions, and have the understanding and expertise to see the long-term impact of these measures on women and families. However, the national women's machinery in the UK has been dismantled and not replaced, and there is a lack of disaggregated data collected to provide information on women's equality. The inconsistency of laws and measures across the devolved administrations, and how the government delivers the gender and development agenda internationally and in the Crown dependencies and overseas territories, is also cause for concern as women's rights slip through the cracks. Understanding women's needs and rights can only lead to increased rights for all, and will ensure that the UK government is meeting the needs of their citizens, as well as their international obligations, and providing an example of best practice that other states can follow. Women of all ages and backgrounds in the UK are facing threats to their rights, but this does not have to be the case if government policies are created in partnership with women's NGOs and include a gendered perspective. This will ensure that there is not a long-term legacy of discrimination against women, and will also impact on the future economy. We must not let women's rights continue to be rolled back.